A case of vulvovaginal candidiasis treated with clotrimazole. Case presentation and history. A 31-year-old woman presented with a 2-year history of vulvar itching and vaginal discharge. Her past medical history was positive for almost monthly recurrences of vaginal discharge and itch. She frequently used self-medication that involved over-the-counter antifungal pessaries which provided no definitive resolution of her symptoms. Clinical examination and investigations. Well-oriented in time, place and person. Pulse, 84 per minute, regular. Blood pressure, 128 by 80 mm Hg. Local examination demonstrated erythema of the vulva and vagina, with a cheesy vaginal discharge. Vaginal swab culture grew Candida albicans. Diagnosis. On the basis of the clinical history, examination and investigations, a diagnosis of vulvovaginal candidiasis was made. Management. The patient was managed with 200 mg clotrimazole intravaginally once a day for 3 consecutive days. In addition to this, topical application of 1% clotrimazole cream was carried out on the affected area 2 times a day for 7 consecutive days. At the 3 and 6 month follow-ups, the patient was completely free of symptoms, and the vaginal swab was found to be negative for Candida albicans. A case of tinea genitalis successfully treated with itraconazole. Case presentation and history. A 21-year-old woman reported with a 3-week history of reddish, dry, rough and itchy skin lesions in the pubic area which were accompanied by nausea, headache and malaise since the past 1 week. She was married 10 months back and had protected sexual intercourse with her husband. Her husband also complained of itching in the pubic region since 3 weeks, for which he was using clotrimazole cream. She also applied the clotrimazole cream, but got no relief in her symptoms. Clinical examination and investigations. Well-oriented in time, place and person. Body temperature, febrile, 102 degree Fahrenheit. Pulse, 86 per minute, regular. Blood pressure, 126 by 80 mm Hg. Local examination revealed erythematous scaling plaques and follicular pustules on labia majora and mons pubis. Blood cell count demonstrated leukocytosis. V-reactive protein and random blood sugar were found to be elevated. KOH smear demonstrated septate hyphae. Sample culture grew tinea interdigital. Diagnosis. On the basis of the clinical history, examination and investigations, a diagnosis of tinea genitalis was made. Management. The patient was managed with 250 mg terbinafine daily along with oral amoxicillin clavulanic acid. In addition to this, oral analgesics were given for pain. On 3-day follow-up, patient presented to the clinic with succulent ulcerated nodules with seropurulent discharge in the pubic area. She was now managed with 100 mg itraconazole thrice a day for 8 weeks along with 50 mg oral prednisone for 2 weeks. On 8-week follow-up, the lesions were healed with scarring. A case of middle-aged women with Pichilomyces lilacinus vaginitis. Case presentation and history. A 48-year-old woman reported with an 8-month history of vaginal itching and discharge. Her past medical history was positive for diabetes and irregular uterine bleeding, for which she was receiving anti-diabetic drugs and hormone replacement therapy. Presumptive diagnosis of candidal vaginitis was made and she was treated with fluconazole, sequentially followed with topical clotrimazole and chioconazole ointment. However, the symptoms continued to persist. Clinical examination and investigations. well oriented in time, place and person. Pulse, 86 per minute, regular. Blood pressure, 126 by 80 mm Hg. Local examination demonstrated vaginal erythema with white vaginal discharge of liquid consistency. Blood cell count and blood glucose levels were found to be normal. Sample culture group E. Lilacinus. Diagnosis. On the basis of the clinical history, examination and investigations, a diagnosis of Pichilomyces lilacinus vaginitis was made. Management. The patient was managed with 200 mg oral itraconazole twice a day for 3 weeks. At 3-week follow-up, vaginal discharge resolved completely with substantial reduction in itching. At 6-month follow-up, no vaginal discharge was seen. Vaginal fungal culture and KOH smear were also found to be negative.